Hey and welcome to the EYFTM podcast, brought to you by the EYFTM podcast team. This podcast is accompanied by a study on listening behavior. Nadine, what's the study about?
Hey Fabian, I'm always listening to podcasts when I'm on my way to university every day. And I'm sure most of you are listening to podcasts too in your everyday life. But have you ever wondered how different podcasts influence your career choices or your personal life?
Well, if you want to find out more about the study, there's a link underneath this podcast in the bio. And now,
have fun with our EYFTM podcast.
Hello and welcome back to the EYFTM podcast. My name is Fabian and we are again recording from Berlin in Germany today. I have another special guest here with us today who invited us to his home, Dr. Elstermann von Elster, hope I pronounced that right, and he's a GP specialist, but because that wasn't enough, he's also an occupational health, palliative care and sports medicine specialist who's currently working for a pharmaceutical company, Bayer, but before he did that, he also did a doctorate in family medicine and social medicine. He's probably going to tell us more about it. Thanks, Max, for taking the time today.
Thank you for having me here.
Max, when I prepared for this interview and I read about all these different specialties that you combined, occupational health, primary care, palliative care, when you signed up for these different specialties, what was your train of thought? Why do you think they belong together?
I think for me, what is most important, I identify as a GP. So that's what I love doing. And I like fixing problems, but I realized I hate those quick fixes. So I really like to dig into different kinds of problems. I love learning, I have to admit. My wife always mocks me. No, but for being a GP, I found it very important, for example, palliative care. I found that this belongs to being a GP. And then there came some other things with my interests. So sports medicine is, to say, a hobby. And I'm also a chiropractor. So that's also interesting. But for me, for being a GP, the palliative care was the most important thing. And now I also like preventive medicine. And since my thesis, I wanted to explore the field of occupational health a little bit more. Because when I was working in a rural office in Brandenburg, I had all those young patients who are 30 years old. They have hypertension, they smoke, and they work shifts. And you're just putting out fires. And I wanted to address the problems a little bit earlier. So that's why I wanted to do occupational health. And I had the luck to get a job at Bayer. Not because it's a pharmaceutical company. So that's my big conflict of interest. I'm always declaring that. I even looked up what they produce. So I'm trying not to make any advertisement for that. But they offer occupational health on a basis that's different than most what German employees get. So we have like a GP's office for the workers in the factory at Berlin, which I really, really like.
Oh, that's very interesting. So when you work for Bayer, would you mind taking us through your normal work day?
The workday is quite different. Some days we do what we call like preventive checkups. I mean, most of the GPs will say, well, that's not really necessary. Everybody has a different thought about that. That's something that Bayer offers for their employees. Every bigger company has to offer something to prevent diseases. That's one part of what I'm doing. I'm also doing checkups that are mandatory in Germany for special workers like who work with infectious diseases or who work with heavy machines. And today, for example, I had some meetings with one chief developer from a company that we also manage who is currently living in Australia, who came here for several days to discuss occupational health in this company.
So you kind of have a mix between patient contacts and also meetings where you discuss elements of preventative care for either subsidiary companies or other factories.
Yeah.
Okay,
Yeah.
Cool. But because that's not enough, you also dive back into the GP practice or the emergency GP services. How do you find the time to do those shifts on top?
The good thing is it's not 12-hour shifts. It's only 6 to 7-hour shifts. And that's my Monday evening. So from 6 p.m. to midnight, I like going out and Papa has to go to work. I'm always saying to my oldest son.
German word for daddy.
Yeah. Daddy has to earn the ski vacation. No, I really like doing that. It doesn't give me a thrill. I don't think I need a thrill, but I need to not lose the contact with my GP self. So I really like treating patients. I really like treating problems. I'm not good at the big emergencies. I'm not an acute care doctor, but I think I'm a good GP and I solve GP problems and be there during the day or during the night. That really gives me joy.
How's that different if you think about your office work with Bayer and then your critical care evening shifts? What kind of patients would you see at work and what kind of patients would you see at night when you work in Berlin?
I really love working at the big company that I see everybody from the smallest intern to the boss level. So we see everybody, which is really good to get a feeling of the company, to see where there are problems, where things are going well, and so many different aspects. That's really what I love about this working as an occupational doctor. Critical care is, everything. It's not the same as in Brandenburg. There are the problems where I think...
Which is the practice that was more rural where you worked before.
Yeah, it was like there was the only office in a 20-kilometer radius. That was different. So there's some people who don't have toilets in their homes. They like all their apartments and stuff. That's totally different. And I realize I'm living in a Berlin bubble, but still everybody has the same medical problems.
When you talk about occupational health in Germany, I wonder, many of our listeners might not be too familiar with the German occupational health system, and some of our trainees who might be US based, they often also discuss the conflict of confidentiality. Is there a conflict between patient care for the patient in front of you and your company's well-being?
You have to differentiate it completely, otherwise people don't trust you. We are 100% true to that because that's the basis of what we do as occupational doctors. So nothing what I learn in my work as an occupational doctor, I can't tell it to any supervisor, anybody. So that's a true and only preventative measure. And that's what I find really important about that.
Are there any things in place that guarantee that confidentiality? Because you would probably also be employed by human resources, so they also control you as an employee.
That's true. One important thing as an occupational doctor is we are not in the line of command of the
hierarchical structure.
Yeah, that's one thing, and that's obligatory. The other thing is that we ought to be in direct contact to the local lead of business. So we have a connection to the local lead. So if we see any problem occurring, we can communicate it to the top, which doesn't work every time, but that's how it should be. And we're not in the line of command. So we act as doctors and we don't act as Bayer employees.
Right. So there are quite some mechanisms in place to protect your patients and the confidentiality that you have.
Absolutely. And of course, also the system that we use, the computer system, is completely separated from the Bayer system. So that's something to guarantee. We could go in further detail. There's the difference between Vorsorgeuntersuchung and Eignungsuntersuchung, but I think that goes too far.
So German words for preventative care and the medical checkups that are necessary for specific posts.
Yeah.
Thanks, Max. I think that's really, really interesting, and I think it might also explain the sports medicine part, because sports medicine and preventative care is probably not too far away from one another. One of the things that I found really fascinating was that last year you didn't just work all these jobs while having your own family, of course, but you also finished an Ironman in 9 hours something, which is pretty impressive. How do you find the time to train for your Ironman?
I don't sleep so much. My absolute number one priority is my family. And I know some people who are divorced in their 40s because they train too much, or who are divorced because they work too much. That's something which I don't want to do. So I'm trying to plan my training around work and family time. So today, before our podcast, I tried to go for a swim. We have a fitness center at Bayer, which I can use in lunchtime, which is really good. And I go out at 5 o'clock in the morning for a bike ride at Saturdays and Sundays.
Oh wow, and that's probably before your family gets up. So you come, when you get home, you've already done quite a substantial workout.
And I come back with breakfast, of course.
Wow, it's really interesting to see how you manage all these different specialties. I wonder, when you look at it from an academic point of view, you did a bit of research on primary care and public health. Can you tell us a bit more about your connection between your your initial desire of wanting to do occupational or preventative medicine and what you found out in your doctorate?
So my doctoral thesis was about leadership and depression, and we validated a leadership scale for its effect on depressive symptoms. And I always found that to be quite interesting because there's some aspects that you mentioned before, asserting a vision, providing an appropriate model, and fostering acceptance of group goals, which were the most important effects which we found out to be linked to less depressive symptoms. And I tried to find out a way to address that in people. And that's something you can't address as a GP because you don't have any access to companies where people work. And even as an occupational doctor, it's difficult because we're only doctors, we're not psychologists, we're not coaches. So there's still work to do.
That's actually quite interesting that you managed to transfer that into your work. So all your findings are kind of reflected in your work life. You might have listened to some of our other podcasts, and we have this A and B game that we prepare for all our guests. 50-word pairs, you pick and choose, and don't think about it too much. You can always say skip if there's anything you want to talk about afterwards. You can always tell me afterwards, and then we circle back. Are you ready for the game?
Yes, I think so.
Ironman or marathon?
Ironman.
Swimming or running?
Running.
Swimming or biking?
Biking.
GP or occupational health?
GP.
Sports medicine or occupational health?
Sports medicine.
Diabetes management or preventative screening?
Preventative screening.
Specialist or trainee?
Specialist.
Pediatrics or geriatrics?
Geriatrics.
Psychosomatic medicine or internal medicine?
Psychosomatics.
Surgery or internal medicine?
Surgery.
Sports medicine or manual therapy?
Sports medicine.
Palliative medicine or occupational medicine?
Occupational medicine.
Night or weekend shifts?
Weekend.
Travel medicine or sports medicine?
Sports medicine.
Heidelberg or Berlin?
Berlin.
English or German?
German.
Spanish or French?
French.
French or English?
English.
Meditation or activities?
Activities.
Phone or laptop?
Phone.
Occupational doctor or inpatient clinics doctor?
Occupational doctor.
Inpatient or outpatient?
Outpatient.
Self-employed or salaried?
Self-employed.
Tram or bus?
Tram.
Bike or public transport?
Bike.
Bus or car?
Bus.
Train or plane?
Train.
This one is a special one. Berlin boulette with potato salad or Berlin potato soup?
Bullet.
Abdominal ultrasound or thyroid ultrasound?
Abdominal.
For occupational health, eye protection or hearing protection?
Hearing protection.
Canada or Luxembourg?
Canada.
Namibia or France?
Namibia.
Lecturer in sports medicine or in general practice?
General practice.
Coffee or tea?
Coffee.
Take time or eat on the go?
Eat on the go.
Wine or beer?
Beer.
Day or night?
Day.
Medical education list for biochemistry or anatomy?
Biochemistry.
Rock your life or in love with safety?
Rock your life.
Tierra del Fuego or Colombia?
Tierra del Fuego.
Ironman or ultramarathon?
Ironman. Definitely Ironman.
Can't get you. Card game or board game?
Card game.
City or suburb?
City.
Holiday or work?
Holiday.
Downtime or staying active?
Staying active.
Hotel or tent?
Tent.
Airbnb or hotel?
Airbnb.
Hiking or city trip?
Hiking.
Study or work?
Study.
Mountains or sea?
Mountains.
Suitcase or backpack?
Backpack.
Family or work?
Family.
Exercise or work?
Exercise.
Well-being or success?
Well-being.
Well, that was it. That was 50-word pairs. There were quite a few interesting pairs. Do you have one that you wanted to speak about other than maybe also the Berlin specialty? Was there anything else that you wanted to speak about?
I think for me, I have to clarify, I'm also an occupational doctor, even though I probably didn't mention it enough. Sometimes I'm thinking back to my first job interview when I was at Heidelberg with all those chiefs, like from the internal medicine, like 5, 6 big guys and women, mostly guys. And they also asked me, you are interested in so many things. What do you want to do? Difficult question.
And you said, well, I'm just going to do all of it.
And then I quit after 1.5 years.
Rock Your Life or In Love with Safety? What is that about?
Rock Your Life was a really good project which we did early in our studies, or which I was able to be part of, where we tried to get a connection with kids from different social backgrounds. And that worked partly, and to try to show them that we're not total douches, which I really enjoyed, but which lasted too short, I think, and we didn't have the impact that we wanted to have.
Another thing that came up quite a lot was different countries. I think Canada, Luxembourg, Namibia. So you did quite a bit of traveling and overseas placements during your medical school.
It started when I was at civil service. I met this guy, Valentin Grüner, who's now doing a volunteer project in Botswana. And then he said, do you want to visit me in Botswana and work with the lions? And I said, I have the time, I have a little cash, I can do that. And then I skipped the opportunity to do a master in public health at Mannheim, which we were able to do, and to travel. But I still don't regret it. And also I met my father-in-law there in Botswana at a gas station because he brought my wife there and we spent a month together in the desert.
So you met your father-in-law before you met your wife?
No, I met her before, but like he worked a lot in Africa and so he came down and it was a good decision to do that. My wife was born in Namibia.
And that sounds like quite a life-changing experience then. Now having 2 kids has probably influenced your life quite a lot.
Absolutely.
You spoke about Heidelberg and the time that you spent at the university in your public health master and your interest. When you think back at the time while you were still in training, is there anything that you would have liked to know as advice, or is there anything that you would give your younger self if you think about it?
I would say if you want to be a boss at a clinic, then go to a university clinic. If you don't want to do that, perhaps don't. So I'm trying to be effective in what I do. I love to work, but I also love to do holiday and family time. And I hate working nonsense jobs. Doesn't mean that Heidelberg was a nonsense job. Absolutely not. I learned a lot, but it's also a big commitment that you have to do. And I profit a lot from what I learned there.
When you talk about Heidelberg, you talk about academic medicine at a big university hospital.
Yes.
Yeah, all right.
I love what I learned, but it's also a big commitment. And I love that I quit after 1.5 years because it would probably have been too much.
And changed into all these different other fields. GP,
Yes.
palliative care, sports medicine. Thanks, Max. Thanks a lot for your time. Thanks for inviting us to your home. That was very kind. And I think it's not from Berlin, but thanks for the German beer. That was very nice. And I hope to see you soon at one of our UFDM events or any other Wonka conferences if you want to come. And I think you are probably quite happy to speak to anyone who finds your occupational health interesting.
Absolutely. Please contact me. Please reach out.
Perfect. Thanks so much, Max.
Thank you for having me.